Good afternoon. And today we have a pleasure of interviewing Mr. Dennis Garcia. He is Practice Development Manager for the wonderful company called Sleep Architect. Even the name I like. It's gonna do the architecture for our sleep, not so much for the sleep, but for sleep and structures around the mouth, around the sleep. So thank you very much for our audience. We appreciate every one of you. And if you know somebody who have a trouble sleeping or sleep next to the snoring partner, please click the like or share button. And this way you help us to promote our channel and help us with our mission of making this world a better place, because well-rested person is definitely a happier person. So good afternoon, Dennis.
Good afternoon, Dr. Sokolina. Thank you for having me here today. It's a pleasure to be sharing these details with you and your audience.
And I'm going to share my own story with Sleep Architect. As you know, I do treatment for obstructive sleep apnea for the last 12 years. And one of the things that I always find challenging, how would I do the oral appliance for patients who have a lot of crowding or a lot of malocclusion? It would kind of break my heart that I have to retain that very ugly pathological position for the very long time. So I start searching, and luckily enough, I came across Sleep Architect company and specifically Dr. Atai. And he explained to me, okay, I don't have to worry about that because there is a solution to that challenge. And I can use aligner sleep appliance. What I can use with the clear aligners, correct the position of the teeth, and use sleep appliance in the same time. In the same time, control snoring and sleep apnea. And I'm gonna show on a screen that appliance. It has a sleep appliance on the top and clear aligners on the bottom. And that's what I use for treatment of my patients who have a malocclusion. And my first question to Dennis. Dennis, please tell me how the idea of aligner sleep appliance was born.
Certainly, Dr. Sokolina. So the aligner sleep appliance, the idea of it came about 10 years ago with Dr. Payamatai, who you've met and chatted with in the past. He, constantly struggled to find treatment for obstructive sleep apnea for his patients who were undergoing clear aligner therapy. And so, along the way, he also had a conversation, met with Dr. Rob Bees, the CEO of Space Maintainers Lab. And so both of them put their brains together, their efforts together to create what we know today as the aligner sleep appliance, which is an appliance that fits passively over the clear aligners as the patients are undergoing active orthodontic movement in their teeth. And so with that idea and that design, patients are now able to do clear aligner therapy and treat their OSA at the same time. And they don't have to wait for however long the orthodontic treatment may last. Because as we know, if they don't treat their OSA, they're going to relapse on their symptoms and feel sleepy, feel bad. And so now we're able to serve both therapies at the same time.
I would like to bring a slide again on the screen. And I would like to ask you, Dennis, can you please talk about some features what your company incorporate in the design of your appliance, what's different from other products on the market, and give us opportunity to treat malocclusion and sleep apnea in the same time. And that's why I'm going to keep the slide that you can explain to our audience, and we appreciate all of our listeners who are listening and getting the knowledge on that topic.
Yes. So the design of the sleep appliance, the aligner sleep appliance, is very unique. As you can see in this particular slide, the appliance is fitting passively over the aligners, and it doesn't have any anterior coverage, so that it allows for all of the orthodontic movement that's happening anteriorly. most of the retention will occur in on the bicuspids and molars. And so it also comes equipped with sagittal screws, so that on the palate and the lingual side, so that if there's any posterior expansion, that the doctors can go in there, crank that, and follow that movement. And it has the buccal adjustment screws, as you can see here, to be used for any mandibular repositioning as the patient is undergoing orthodontic treatment. And so, those are really the main features of the appliance and the design for the aligner sleep appliance.
I'm going to ask you, Dennis, if you can talk a little bit closer to your microphone because the sound is not so loud. I want to make sure our patient can, our listeners can really clear hear what you said about the design. And I would like to ask you, I know that's not the only design you have for aligner sleep appliance. What other modification your company incorporate? Because I know some patients can have a very severe forces, and if they are strong grinders, what features, how you adjust the design to fit to that specific, very common story for sleep apnea patients?
Yes, no, for sure. So let me bring up an example of the most standard design. And, before I elaborate more on this, we always incorporate a clinical review of the case with each doctor to get a good understanding of what would be the most appropriate design. We want to keep comfort in the mind, comfort of the patient, that is, and successful incorporation of the therapy. So what you see here, for instance, is the most common design, where the appliance on the upper has a belt that stretches over the palate, no anterior coverage, and then you see the lingual and the screw there as well. And so that would be the majority of the cases. But in certain situations where the patients don't are not comfortable with that design, we also are able to incorporate designs with a little bit more horseshoe shape to it, as you can see here in this example. Well, I think that jumped a little bit.
No, you did very good. I really like that idea. For some people who can be who can gag easily, or they just don't like to have anything on a palate, just they can't stand it, that would be the great design. And for Brooksers, it's another great design we see here with the mesh.
Mm-hmm. Yep. So this is a design that incorporates a reinforcement there on the occlusal areas. And so we're able to really customize the design as much as possible, so that your patients are able to be comfortable and are able to use it. The main idea, the reason why patients stop using therapy, whether it's CPAP or any sleep appliance, is lack of comfort. So we really focus on that.
Yeah, no, that's very important, especially now they're wearing not one, but two appliances at night. And again, we do have our audience, and we would appreciate your questions in the chat box. This way we will find the answer about aligner sleep appliance and clear aligners in the same time. So my question to you regarding the design, I know you have a design team and they work hard on the designing of oral appliance. What's so different in the designing of a clear aligner case for orthodontics or clear aligner case for aligner sleep appliance? What specific features doctors have to keep in mind when they accept the clean check?
Yes, that's a very good question, Dr. Sokolina. So let me go over a little bit of the process. We like to have an opportunity to review either the ClinCheck, the ClearCom, any orthodontic simulator where we can see what the plans are for orthodontic treatment by the doctor. The aligner sleep appliance fits over any clear aligner service out there. And so what you see right now is an example of the main difference that we look at. We want to avoid fabricating an appliance that's too bulky and could be uncomfortable for the patient. So in this example, we see that there's attachments on the molars or bicuspids in both sides. And so what we strongly recommend is that unless there is some serious extrusion, considering for the molars or the bicuspids, that attachments are really not a requirement or necessary. Our clinical team will have the opportunity to chat with the doctor about that. And so we could definitely fabricate and retrofit it over the attachments, but it's going to make the appliance really bulky. And that's going to impact the patient's use. Another example is, say, for instance, if you're planning any buttons, here in this example, you see, the planned use of elastics. And so what we recommend in those cases is that the patient will wear the sleep appliance at nighttime to treat their OSA, but they can wear their elastics during the daytime, so that you can set those kind of treatment expectations with the patients and still be able to treat them according to your plan. Just keep in mind the difference is now you're considering the airway health and the treatment for OSA when you're designing this case. And again, our clinical team is always available for feedback, ideas, and reviews of your plans, so that we can together help you set up a successful treatment for both therapies.
I have another question for you. My question about the materials, because sometimes patients might have allergy and they're very interested what material we use. I would like to ask you about several types of the material for the base of the appliance and material for the screw, because some people might be allergic for acrylic, with acrylic, and tell me what choices we have there. And some patients can be allergic to the screw material. Tell us about that.
Certainly. So first, if you do have a case of a patient who is allergic to any materials, we're able to provide you all of the summaries of everything that we use for the sleep appliance. We do have options, and we could always review that with every particular case. In general, what I can talk about is, the device does include acrylic or thermoacrylic materials, and it does include metal components and the adjustments of this mechanisms that are incorporated in there. And again, we can certainly review that. As a default, we do fabricate the sleep appliance in a thermoacrylic material that's called Astron. And the nice thing about that material is that doctors are able to dip it into hot water during the delivery consult. And you dip it into hot water, very similar to pink wax. And it's not it's not thermoplastic, so it's not that weak. It's actually very strong and durable. And by dipping it into hot water, the material reacts and conforms a little bit more nicely to the clear trays. The appliance will most of the time be designed to fit passively because, again, of the nature of the combination therapy, to allow tooth movement. So it won't snap into place like many traditional monotherapy sleep appliances. But upon request, we could also fabricate them in full acrylic. You may have to get a little bit in there with your burr to make some adjustments if that's the case. And we can also fabricate them in a soft inner, hard outer. And in some minimal cases, although we don't prefer to add ball clasps, but if the undercuts are not significant enough to retain the device, we may recommend some ball clasps. But those are the options in terms of the design of the material.
I actually use all choices of yours. I use one with the ball clasp, and in some cases I like the idea because I can really make it, stay strong. And regarding the metal, if you able to give, doctors, the full list of the metals what contain you screw, or if any other choices can be done. That's not common questions, but things like that happened.
Yes, no, definitely. We're able to provide them, information about nickel screws, titanium screws, and any of the other metal components like the ball clasps that are going into the design. Again, the ball clasp is the very small percentage of cases. that we design. The best thing to do is with every aligner sleep appliance, we offer a clinical review and guidance. And so we'll sit down with you doctors and teams to review your specific case, and we'll be able to provide all the materials that you need to review with your patient.
No, that's wonderful. I experienced that. I did a lot of cases, and I use aligner sleep appliances for cases when I did kind of a combination of treatment. I would say I aligned the teeth, and then I did the prosthetic for the patient, and I still use aligner sleep appliance during the course of treatment because it gave me so much more flexibility than traditional oral appliance, which made, snugly fit to the teeth, and in the same time patient can control apnea. But I would like to ask you, what's the most common complaint or challenge you get from the providers who work with aligner sleep appliances? Like, I would like to know all the obstacles.
Yes. No, definitely. So, Dr. Sokolina, in our experience, the most common feedback we get out there is doctors genuinely wanting to understand how to, bill medically and how to set their fees accordingly with patients when they're dealing with a combination therapy. Because now you have two therapies, right? You have the aligner sleep, the clear aligners, and there's one fee for that. And then you have the aligner sleep appliance or the, sleep apnea treatment, and there's one fee for that. And so many times we find that practitioners believe that they may not be able to leverage medical insurance, for instance, and get reimbursements for their treatment. And so many times that is also the case because their staff members are not trained in medical billing, mostly for dental billing. And although there are some similarities between dental and medical billing has a lot more complexities when it comes to the treatment of OSA and really any other medical condition. And so we're able to provide them that support. We're able to talk to practitioners about how to set their fees accordingly and keep it accessible as well. I mean, at the end of the day, you are treating the patient for a nice smile and for a potentially deadly condition, OSA. And so, it also involves setting clear expectations with your patients about that treatment and helping them really see the value in that and keeping it affordable while you're still able to pay, your rent and your staff and everything. So we understand that those are some of the key questions out there, and we see that commonly.
I would like to add the slide. Slide to our program, because I want to make it clear for our audience that there are two different treatments in this particular appliance, or maybe not two different treatments, but dealing with two different insurances. For clear aligners, that's the dental billing. And for aligner sleep appliance, that's the medical billing. So it's make, I would say, for our audience who are patients, it's make it a lot of effort. I want to let my audience know it takes a lot of effort to maximize the insurance coverage. Treatment is absolutely great, but it's very important, and we appreciate our staff who goes out of the way to maximize the insurance coverage with two insurances. Even with one insurance, it can be challenging, but with two insurances, it's become double trouble. Yeah. So we try to do that to make this treatment accessible to our patients, but treatment is great. So again, dental and medical portion. I would like to ask you now, the question what's in style right now. We on our channel, we talk about different treatment for obstructive sleep apnea. Some people cannot wear the CPAP, they go to oral appliance, and some people not really happy with the idea of wearing oral appliance all their life, even can be aligner sleep appliance or any other sleep appliance, so they want to have a surgical option. We're talking about orthodontic surgery. And to have orthodontic surgery, you have to have a straight teeth to be able for oral surgeon to put two arches together and stabilize them after the surgery. So they need orthodontic treatment. And for those patients, again, we get back to question number one. They cannot wear the CPAP. Oral appliance, traditional oral appliance, not gonna work. So tell me, Dennis, your experience for cases like that when a doctor have to use aligner sleep appliance to prepare the patient for orthodontic surgery.
Yes. So, Dr. Sokolina, we understand that in order to prepare the patients for this type of surgery, you need nice aligned teeth and everything that comes with, clear aligner therapy. And so, the best process there in that case is you want to treat the OSA prior to surgery, so you can use the aligner sleep appliance over the clear trays. We know out there that CPAP is a very difficult proposition. I mean, close to 70% of people rejects the use of CPAP because of comfort. So this is a perfect opportunity and choice, the aligner sleep appliance, to use together with your aligner treatment prior to that surgery, and be able to really help the patient treat their condition while you find a more permanent solution in surgery.
Also, I would like to ask you a little bit futuristic question. I always ask the futuristic question. How are you fully digital, or you still accept the impressions?
Oh yeah, no, we're fully digital. Let me see. In fact, I'll go to this example right here. I don't know if my slides are up, but we receive scans, intraoral scans for any case. In fact, that's most of the case submissions that we see. We are able, if you have iTero in your offices, you can set us up SleepArchitects under your iRecord drop-down menus. We provide instructions on how to do that. And iTero is the quickest way, or any other intraoral scanner. If you have any other intraoral scanner, we do provide instructions so that you can export the upper and the lower into STL files, and then we'll be able to receive those and print the models. And but if you only have if you don't have any of those intraoral scanners, we still receive impressions. Good old-fashioned impressions work well.
No, I would like to mention on this slide, like, you circle out the tori, and, sometimes with the tori, you still have to scan it, and the appliance not going to sit over the tori. Appliance going to have a space. And maybe for the cases like that, if patient has a big tori, then appliance can be brought to the front and have a screw right behind the front teeth. Please tell us the practical question. How far can you expand with that screw?
Yeah, definitely. And just a final note, just to piggyback on what you were commenting here, Dr. Sokolina, it's really important. We always provide instructions to scan most of the palate, again, for the same reason you said, because, as you can see in this example, most of the aligner sleep appliance cases go over the palate. So we don't want to guess. We won't fabricate an appliance if that's the case, if we're missing the palate. But now, talking about the more technical aspects of it, let me go to this slide over here where we have technical measurements. So the buccal screws on the upper, we can incorporate 6 millimeters or 8 millimeter screws in there for mandibular movement. And then you also have the midline screws on the lingual and the palate, and those can go from 4 to 6 millimeter expansion or tilting of the teeth, and that's the capacity that you can plan for. And we'll be able to review that in your clinical call or feedback to get a better understanding of how much you're expanding. I mean, normally we see cases that don't expand beyond 3 millimeters posteriorly, but if you are planning for additional expansion and refinements down the line, then we'll talk about very specifically about your case and what may be needed.
And I would like to ask you, among your treatment crew, the people who, the doctor crew who order your specific treatment choice. There are mostly general dentists, or you have some orthodontists who also do this specific treatment.
Yes, no, most of them are actually general practitioners. We do have orthodontists on board who order regularly as well. And so, the best thing about this process is that we're able to pair up practitioners with clinical advisors. Dr. Atai is a very active advisor, and you've had conversations with
Yeah,
him,
man.
Dr. Sokolina, right? So anybody who's really trying to deliver the aligner sleep appliance for the first time, please don't fret. We got you covered. Our advisors will jump on the scene. We will sit down and review your ClinCheck, your ClearCom, your orthodontic plan. Dr. Atai may jump on the call with you and talk the lingo and really help guide you in that process. If this is your very first case, we want you to have success with your patients. We want them to be treated. And so that's really what we're focusing on, a successful process of interdisciplinary approaches and collaborations. And then our advisors have tons of experience with sleep cases, particularly with the aligner sleep appliance. So, we got you covered on that end.
No, I can testify for that because I've been doing the treatment with aligner sleep appliance, I would say, for the last 3 or 4 years. And yes, you have a great support and you have a lot of materials and you have the webinar. So that's no shortage of that. That's the, great company to work with. And we're going to have information about aligner sleep appliance for the doctors who are listening to us on the bottom of the interview. This way, you can communicate with Dennis or Dr. Atai. They're all very helpful and friendly and have a desire to help and make our patients not only control the obstructive sleep apnea, but also have a straight teeth and more space for the tongue and to have a correct tongue position. That's what we highly advise for successful treatment. So thank you very much, Dennis. We really appreciate your time and your expertise. And I think we learn a lot about aligner sleep appliance and looking forward to work with you more. Thank you.
Thank you, Dr. Sokolina. It was a pleasure being here with you today and your audience. Thank you.